Dental problems are never fun, but did you know a certain dental condition may be a warning sign for heart disease? These are the health problems your pearly whites may be trying to tell you about. Your teeth are tough on the outside, but on the inside there are massive tissues and blood vessels, including some of the most sensitive nerves in your body. So if a tooth problem affects those nerves, the pain can be through the roof. Not every toothache is a 5-alarm fire, though. Sometimes the gum around a tooth is irritated, a temporary condition that resolves on its own. But pain that comes from the tooth itself could indicate tooth decay, infection, damage to the tooth, or other serious problems. If the pain isn't out of control, you can try to manage it by eating soft foods, rinsing the area with warm salt water, applying a cold compress, or taking over-the-counter pain medication. Applying a drop of clove oil, vanilla extract, or a peppermint tea bag that's been steeped and cooled down may help as well. If the pain's intolerable or gets worse despite your efforts, it's time to see your dentist. Don't take this the wrong way, but you've got a dirty mouth.
How dare you, sir?
By which we mean it's full of bacteria that would like nothing better than to settle down and raise a family in the posh neighborhood that is your oral cavity. And if you don't keep to a regular practice of brushing and flossing, those bacteria can infect your gums, which is bad news for the health of your whole body. Along with poor oral hygiene, gum disease risk factors include smoking, diabetes, and the use of some medications. Symptoms of the infection range from red, swollen, or tender gums to persistent bad breath, sensitive teeth, loose teeth, a receding gum line, bleeding gums, and pain when chewing. Seeing a dentist for a possible gum infection is important not just for the health of your teeth, but because gum disease has been linked to other health problems. One study found that people with gum disease had an increased risk for rheumatoid arthritis. Perhaps because the bacteria involved triggers the body's immune system to attack the affected joints. Research has connected gum disease to lung problems like asthma and chronic obstructive pulmonary disease, since harmful bacteria that infect the gums may end up in the lungs and respiratory tract. Those germs also seem to raise the risk of hypertension, either because they infect blood vessel walls or trigger a damaging immune system response. Tooth loss among adults due to disease or injury is declining, but it does happen. Research by the CDC found that 67% of adults aged 20 to 39 had a full set of permanent teeth. However, among adults aged 40 to 64, that number drops to just 34%. It turns out that losing a tooth can be a warning sign of trouble to come, particularly regarding cardiovascular disease or CVD. One study of health data from nearly 8,500 people found that tooth loss raised CVD risk, with the risk more than doubling among people who were missing 5 teeth or more. Another study found that risk was elevated by almost 25% for people who lost 2 or more teeth in middle age. According to a study of tooth loss risk factors, dental caries like cavities and gum disease are the biggest contributors to tooth loss in adults. It's possible that the bacteria that cause these oral health problems also damage the cardiovascular system, or that the body's immune response to them leads to health problems, but the exact connection has yet to be determined. Blood coming from your gums is disconcerting, but it's not always a cause for alarm. If you've just started to floss regularly, your gums may bleed at first and take a week or so to adapt to the new treatment. A too hard toothbrush can also make your gums bleed. The ADA recommends using a soft or extra soft bristled brush to mitigate this issue. Your gums might also tend to bleed if you take blood thinning medication or if you're pregnant. On the other hand, bleeding that's excessive, doesn't go away, or doesn't have an obvious cause warrants a visit to the dentist. Bleeding can be a sign of early gum disease, meaning bacteria are inflaming your gums and potentially threatening your oral health. Gum bleeding can also be a sign that you need more vitamin C in your diet. A tendency for gums to bleed was associated with low blood levels of vitamin C, and that increasing vitamin C intake stopped the bleeding. People who don't eat vitamin C-rich fruits, such as folks on a low-carb or paleo diet, may be at particular risk for this. Unless you're young enough to believe in the tooth fairy, your teeth should pretty much stay where they are. If a tooth is loose in its socket, that's not normal and should be checked. In adults, a loose tooth is a red flag for periodontitis or advanced gum disease. Infection of the gums can weaken the tissue that holds a tooth in place. If it's caught in time, the infection can be reversed and the tooth can be saved. Sometimes the hormonal changes that occur during pregnancy can affect the bones and ligaments holding the teeth in place, causing one or more of them to feel loose. This resolves on its own, but dental visits during pregnancy are important to rule out gum disease, which has been linked to premature birth. if a tooth has been loosened by an injury, see your dentist as soon as possible. Other potential causes for a loose tooth include osteoporosis and bruxism, also known as teeth grinding, both of which should be addressed with your physician.
If my assessment is correct, you grind your teeth?
Teeth can crack from wear and tear or from injury, but whatever the cause, the sooner it's treated, the better. You might not be able to see the fracture, but the damage can produce pain while chewing, sensitivity to heat or cold, and pain that comes and goes. Eventually, the pain can become constant, and the crack in the tooth's outer layer may cause an infection in the pulp inside, which can spread to the surrounding bone and gums. While the fracture itself can't heal, an endodontist can restore function to the tooth by placing a filling or a crown to cover the damaged area and keep it from getting worse. Left untreated, a crack is likely to worsen, eventually reaching below the gum line. At that point, it's likely the tooth will need to be extracted. You can lower the odds of suffering a cracked tooth by not chewing on hard objects like ice cubes and unpopped popcorn kernels. And if you have a habit of bruxism, talk to your doctor about options for managing it. If your dentist tells you that you have a dentigerous cyst, it may sound ominous. But don't panic, you're probably not in any immediate peril. These fluid-filled growths, which tend to affect people in their 20s or 30s, are sometimes too small to be noticed. Symptoms, if there are any, can include tooth sensitivity, swelling, displaced teeth, and a small bump where an adult tooth is going to emerge. Most of these cysts are easily removed or drained, and it's probably in your best interest to do so. Even a small cyst that's left untreated can become infected. It might weaken the nearby gum tissue, possibly leading to tooth loss. It could even weaken the jawbone, causing a fracture to develop. Bottom line, if your dentist recommends the cyst be removed, take their advice.
I'm afraid I must insist.
In terms of worst-case scenarios, an abscessed tooth is the Armageddon caused by gum disease, tooth decay, or tooth injury. Those conditions can leave your teeth and gums open to infection, and if that infection progresses far enough, you're gifted with a pocket of pus, known as an abscess, forming at the root of the infected tooth. An abscessed tooth can cause sharp, throbbing pain, but not always. Other symptoms include swelling and gum redness, a sensitive tooth, a bad odor, and a bad taste in your mouth. It can also be accompanied by fever, swollen lymph nodes, and trouble breathing or swallowing. Any of those symptoms are grounds for a trip to the ER because they mean the infection is spreading from your tooth to the rest of your body. If you suspect an abscessed tooth, get to the dentist because it won't go away on its own. Depending on the extent of the infection, an endodontist may need to remove the tooth, or it might be saved with a root canal procedure.